Well, good afternoon, everyone, and welcome to Alert Level 3. And for our overnight update and today's media availability, we'll now begin with Dr. Janice Fitzgerald.
Thank you, Premier. Good afternoon, everyone, and thank you for joining us. Since the media advisory yesterday, we have no new cases, and the total number in our province is at 261. One person is in hospital due to the virus, and 256 people have recovered. In total, we have tested 13,449 people. So today we're entering Alert Level 3 in our provincial plan for living with COVID-19. This is a huge step forward and only made possible through our dedicated collaborative actions, tenacity, and diligence. We did exceptionally well in Alert Level 4, and I'm confident that if we continue to proceed with the same caution and focus, we will do well in Alert Level 3. As with the previous phases of our plan, public health officials will be continuously monitoring our situation, and as things evolve, so will we. Our success in Alert Level 3 will depend on each of us. We must continue to stay home when feeling unwell, keep our physical distance from others in the workplace and in public spaces, and carry a non-medical mask, scarf, or other cloth face covering when that's not possible. We must cover our coughs and sneezes, avoid touching our face, and wash our hands frequently and well. How well we adhere to these simple but effective measures will help determine how quickly we move to Alert Level 2. This is an important milestone and one that will allow us to move about more freely than we have in months. As businesses and activities reopen in a modified way, I ask for your continued patience and support as we each adapt to the changes this alert level brings about. Businesses have been working hard to put protocols in place to allow them to reopen safely to the public. This includes things such as reduced occupancy, staggered hours of operation, assigned entrances and exits, and one-way directional traffic. Please be mindful of these protocols before entering any establishment. These measures are in place to help protect us, and it is imperative we be respectful of them and the people we encounter while we're in these premises. Many businesses will continue to offer online ordering and curbside pickup, so when possible, please consider this option to help reduce the amount of people out and about at any given time. Public health staff, in consultation with industry and based on best practices and evidence, have developed guidelines for the safe operation of businesses and activities. These include retail stores, personal service establishments like hair salons, tattoo parlors, and spas, restaurants, public markets, outdoor sports, and swimming pools, and campsites. For more information about these and other guidelines, please visit gov.nl.ca/COVID-19. We know this will be our new way of life for a while, and as we begin reuniting with family and friends and doing the things we enjoy, let us do so in a way that keeps us healthy and safe. So remember your physical distancing. We have worked hard to get here. We must work just as hard to protect each other and the gains we've made against this virus. As a recap for those who may have just joined, we have had no new cases since yesterday's media advisory. The total number of cases in the province is 261. The camaraderie and unity we have shown in the face of this pandemic is nothing short of remarkable. And it certainly comes as no surprise how Newfoundlanders and Labradorians will always support each other, both in good times and in bad. Together, we have come a long way. May our success today be a catalyst for renewed hope and a steady guide as we face the future. Hold fast, Newfoundland and Labrador. Thank you.
Thank you, Dr. Fitzgerald, and once again, thank you for the good work of the public health officials. As been mentioned already, day 11, no new cases of COVID-19 to report. That's, from what I understand, it's about just one new case that we've had, which was travel-related in the last 31 days. So it's a good streak as we now enter Alert Level 3. About a month ago, it was just over a month ago, that on April the 30th, that we launched our plan, NL Life with COVID-19. And that plan provided Newfoundlanders and Labradorians with a look at what life would be like as we live with this virus in our province. Now, we've already moved from Alert Level 5 to 4 in that plan. And we are now in a position to further gradually relax some of the restrictions on businesses and services as we move into Alert Level 3. Now, we have all personally experienced how this virus has affected our way of living. There's no one in this province, I would argue that no one in this country, has not been impacted in some way, shape, or form with this virus. So as we move through our alert levels, we know it will affect our lives going forward. We also know that this is a virus that is very capable of moving very quickly. So our plan in our life with COVID is our guide on how we can safely adjust to living life with this virus. Now, as time goes on and more restrictions are lifted, it's important that we continue to follow the health measures that are put in place. It's important that we continue to work together to get this right, as our priority remains your health and your safety. Not only are we moving into Alert Level 3, we will soon see more movement on the waters, as an example, as Labrador Marine is resuming their North Coast Marine service on the Comatic W on Sunday, June the 14th. That will be the earliest that we've seen passenger and freight service to the North Coast, and it's 3 weeks ahead of last year. So they are starting to accept freight for delivery today, and you will also see some improvements where the freight will be received and leaving Happy Valley Goose Bay. So good news for the North Coast. So in keeping with the COVID-19 health measures, passenger capacity is set at 53 people to allow for safe physical distancing. So they are setting aside a number of spaces for each community, which is good news for the residents along the north coast of Labrador, and keeping in mind that those are fewer numbers per trip than last year, simply because of the guidelines that are put in place. Also today, the Prime Minister Trudeau, announced that the federal government has cleared the way for family members in the United States to come back home to Canada. And what Newfoundlanders and Labradorians have to keep in mind, however, is that if you have family that are in the United States and looking to come to our province, they must adhere to the current health measures in place for travel into Newfoundland and Labrador. That means applying in advance for the exemption order, and this measure should take place before anyone starts their travel. If there are any questions around this, please visit the COVID-19 website and click on the travel button, which this is where you'll find a list of all the information related to traveling into and within our province. You will also find some guidance and forms such as travel declaration forms, travel restrictions exemption request application, the one that I just mentioned, and self-isolation tips and support for returning travelers. So it's important that you get this work done before considering traveling back into Newfoundland and Labrador. So before those travel plans are made and before any travel is taken, follow these steps. Newfoundlanders and Labradorians have done an outstanding job of following the health measures, as Dr. Fitzgerald has already said. It's every day your actions have protected you, your family, and your loved ones. The results we see in our province today is because of your hard work, and they're truly remarkable. Many people are looking for further relaxation of measures. Just use common sense, please. Be responsible. Make sure you keep yourself safe. At Level 3, this is the outcome of all of us working together as Newfoundlanders and Labradorians. Now, as we move into Alert Level 3, let's stay the course and continue the great work so that we can be proud of what we have done in flattening the curve here at home. So as we can one day look back in this part of our history, this pandemic, and we can all know and be satisfied that we did the right thing. Dr. Fitzgerald, based on the success that we've had, there is a possibility, as he's already said, there is a possibility that we could move into Alert Level 2 before 28 days. But this can only happen with the discipline of people in Newfoundland and Labrador, so we encourage you to take every precaution. Precautions like washing your hands, wearing masks, and physical distancing as to be part of what is our new daily routine. We cannot wait this out. We must adapt our lives to it. So it takes adjustments, some cases, big adjustments for us, and we understand that. What might seem awkward now will one day be normal. If there's one thing that hasn't changed in our province, it's the goodwill of people and the groups in our community. You have gone above and beyond during this pandemic. Community groups have been supporting some of the most vulnerable people in our communities, and we have witnessed so many wonderful acts of kindness. Then there's organizations throughout Newfoundland and Labrador that really stood up, and they really stand out. Groups like the Salvation Army, people who stepped up early when we were at this table announcing positive cases in our province. Since March the 28th, very early days in this pandemic in our province, it was the Salvation Army volunteers who willingly gave up their time and skills with unbelievable dedication and compassion. Major Lovelace and Lieutenant Maurice Collins of the Salvation Army touched base with us today to tell me that the work that they have been ongoing with the partnership with us and Marine Atlantic. And we have to share some of those numbers with you. If you remember back at that time, we had truckers that were coming into, essential workers coming into our province delivering goods. And since March the 28th and June 7th, which was yesterday, 50 volunteers have been collectively served over 2,500 meals in Port-aux-Basques. And during that time, those 50 volunteers have put in 3,346 hours of volunteering. Absolutely incredible work by members of your community. So now as we move into Alert Level 3, where restaurants are reopening, the Salvation Army, of course, is winding down its service. So on behalf of the people of our province, on behalf of all of us that have received the benefits of you supporting our trucking industry, we say a big thank you. It's stories like this, of course, that really warms our hearts and makes for some great memories during this pandemic. Newfoundlanders and Labradorians will continue to inspire us. So we should all take pride in how we have responded and how we have come together to weather this initial wave of COVID-19. So as we continue to adapt to living with COVID-19 at our doorstep and in our communities, there is room for optimism, but we cannot rest on our laurels. We have to remain ever vigilant and respect the power of the virus. The message has been clear across Canada and around the world. This virus is with us until a vaccine is available. And that could take some time yet. The approach that has been laid out by Dr. Fitzgerald and her team balances the relaxing of public health restrictions with the prevention of a future spike in positive cases. Now, together we have proven that Dr. Fitzgerald's thoughtful public health policies, proven to work. So if we move too fast or stray from the best public health policies, we could compromise the progress that we have made and made such personal investment into. That could threaten the lives and threaten the health of our family members, our friends, and our neighbors. So for the foreseeable future, Newfoundlanders and Labradorians must continue to follow what is tried, what is true, and what is tested of public health measures. I mentioned our COVID website earlier in regards to travel guidance and forms. If you have any questions around Alert Level 3, the website also serves as a reliable hub for all things COVID-19 in our province. On Friday, I also mentioned about the importance of consistent signage and posters for businesses as they open up. So you can visit the website for a copy of these posters there that you can print them off and use them in at your locations. So to everyone, let's keep the good work going. We are all in this together, and we will get through this together. So I now invite Minister Haggie for his remarks today.
Thank you very much, Premier. And again, zero and the prospect of level 3. This pandemic, in many respects, has been an issue of numbers. It's day 92 of our emergency state from a public health point of view. And as Premier referenced, it's day 11 with no new cases. The individual challenges that the restrictions have placed on people have actually produced a significant public health benefit, though. We are in, from a health point of view, a very enviable position if you look across Canada in general. And that's down to a lot of hard work on a very individual level by people who were prepared to accept their need to give a little for the benefit of all of us. And so thank you very much again, I would add to that. As level 3 comes around and we start to see an increase in activity, I think it still behooves us, as the Premier has said, for us to think about the consequences of what we do in the light of the things we now know about COVID. So we've seen essential stores work in a different way. We'll now be in a situation where we can go to stores we may not have visited for 2 or 3 months. But they will not be able, and nor should we expect them to work the way they did in February. They too need to adapt to the new realities of living with COVID-19, with physical distancing, with hand sanitizer, with masks and that kind of thing. So as this week unfolds, I would ask you to give a little thought for those people in there too, and everyone just to take a deep breath and relax a little as you can. It will not be business as usual in that sense, and people need to adapt their expectations as well as their behavior. We have new ways of doing things. You haven't seen us on the podium wearing masks because we can observe physical distancing. But I think when the House of Assembly opens tomorrow, you will see that when physical distancing is a challenge, that masks are there and they serve a good purpose. In terms of our numbers as well, we now have a modest number of people who have had COVID-19 and have recovered. And the Canadian Blood Service has now actually issued a notice that they're looking for patients like that. So if you are over 67, younger than 67, my apologies, if you have been diagnosed with a previous positive confirmed test, and you're fully recovered for at least 28 days, they would like to hear from you. Their website at blood.ca has a special page. It's /convalescent plasma, and they're interested in signing you up as a donor should you be otherwise able to do that. So I would encourage you to participate there. It is National Blood Services Awareness Period, and I know one of my colleagues has donated his 300th unit of blood. So they are a service that is there for us, and it's in you to give, as they say. From the point of view of other changes around healthcare, I think the most heartening from my point of view, and the one that was the hardest institute, is this whole issue around visitation for long-term care and for the various areas in acute care. And over the course of the next couple of days, you will see changes to allow visitation to occur in a modified way. It won't be the kind of free-for-all it used to be, but it will allow that physical and social contact between family members that has been a casualty of COVID-19. So be patient. Each RHA has plans they will roll out, and they may look different in different facilities. So the new Western long-term care, for example, may have different visiting arrangements than, say, Lakeside Homes in Gander or Bonniews up round the Loop or Pleasant View Towers, simply because of the way the buildings are designed. But it's coming. It will also affect acute care as well, and there will be clear guidelines, and you should contact, over the course of the next couple of days, the unit on which your loved one resides for proper and accurate information. So that is coming, and I'm pleased to say that I think will be a significant improvement in the quality of life, as it were, for individuals concerned, because it was the hardest of the decisions that we had to make. Within the healthcare system writ larger, blood work starts up this week, not just urgent and emergent, but the emphasis will be to start with on chronic disease management, and those arrangements will be published by the regional health authorities over the course of the next few days. So the true once-a-year routine blood work will not be a priority for this week and this level, but, for people who have diabetes or rheumatoid arthritis, those kind of things, those kind of blood tests will start up again over the next little while. We are actually nearly at 70% bed occupancy across the acute care sector as the number of procedures and inpatient procedures ramps up. We are still a little bit challenged, particularly with gowns, but staff advise me that the balance is just about right. Private clinics will start up today. Time-sensitive and emergent treatments have always been available through clinicians outside of hospitals. But now the private clinics and the Eastern Health clinics particularly will start to ramp back to their normal level of business. It will not be business as usual. The waiting rooms will look different. Your expectation of whether or not to have a mask, a hand sanitizer, and these kind of things will be made clear at the door when you go in. But that, again, will take some of the pressure off people who have been concerned about their own health. We still continue to advance virtual care as not only a solution for COVID, but also a new way of the future for doing a lot of care, not just primary care. And later on this week, we'll be showing some developments around virtual care and 811 that I think will be quite exciting. So well done, Newfoundland and Labrador. Keep your distance, wear a mask if you can't, and keep it up. You've done extremely well, and we're all in a far better place than we thought we would have been. So with that, Premier, I'll turn it back to yourself.
Once again, thank you, Minister, and we will now open it up to the media for today's questions.
Thank you, Premier. For the benefit of our speakers, we have 7 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of this briefing is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Please do not press star 1 until your name has been called. Following this, should time permit, there will be an opportunity for single questions. Our first questions today are from Tyler Dunn of BOCM News. Please go ahead.
Thank you. Those in the tourism industry have not been able to access the application for the Tourism and Hospitality Support Program, which was supposed to go live today. Just wondering when the application process will open up to those who are eagerly awaiting it.
Yeah, I know there might have been a glitch or two with by all indications. This was supposed to be open up today, but we want to get this, moving as quickly as possible, Tyler, as you just mentioned. And we know that on the other end, once the applications come in, the assessment will be a very short period of time, and we could get the supports that we put in place for the tourism industry. That'll be put in place rather quickly. So today. A few little snags, I think, along the way, but nothing that cannot be overcome. So we want to get this site up and running so we can get the money in the hands of those operators as quickly as possible.
Excellent. And with the reopening of so many doors in the province today, all of which have been provided guidelines on how to operate safely, I'm just wondering, are there any penalties for those who do not adequately meet those guidelines?
So at the moment, we have the ability to have inspections to make sure that things are being followed. That's on a complaints basis. As you can imagine, and as you said, there's a lot of stores that are opening, so it's impossible to be in every one. But if there are concerns, certainly there are ways to follow through with that. And if there is a significant concern, then certainly it can be investigated if need be. But I think, the business community has been very engaged in this, and they are eager, as I'm sure many of you are, to be able to have a successful level 3. So they have been quite engaged and quite eager to do this safely.
Thank you. And we've heard from some concerned residents on walking trails who say they're constantly being passed by joggers who are without masks and unable to keep 6 feet apart when passing those on the walking trail. What would you say to those who have concerns around that?
So certainly it would be very difficult and perhaps unsafe actually for joggers to wear a mask when they're actually working that hard. But we would ask people, if they're out on trails, to be respectful of other people's distances and try to keep, or other people's spaces, I should say, and try to keep a distance of 6 feet between them and somebody else. The interaction is very brief, and it is outside, so the risk is lower. But try to be as respectful as possible about other people's space.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Looking back at the last 28 days of the alert level, we've seen not a single case related to expanding the alert levels. The only case we've had has been travel-related. Bubbles have expanded with no new cases. We even saw large gatherings, for example, fisheries protests without any new cases. No one's showing up with COVID at the hospital. So I'm curious, where is the evidence to back up the claims that we still have virus in our province? Doesn't this show that we would be able to do, like, for example, New Zealand has done, and open things up more fully within the province while still maintaining border controls to prevent the virus from coming back in?
So there's a couple things in that. Number one, there are still people coming into our province, and we know that importation is our risk. So yes, our prevalence all the evidence right now would point to the fact that the prevalence in our province is low, but it is not, we cannot confirm that it is zero. So to put that that train of thinking out there could be potentially worrisome, because we still have to be cautious that this virus can come in. So people are entering the province and can bring in the virus. And, you know, when we think about controls, there are other things that we have to think about as well. It's not just our border control; it's the national border control, and the movement of people in the country. So, you know, it's not as easy as just opening it up and letting things happen. We also know that as people move around more, there's going to be more opportunity for anyone, if they have the virus, to pass it on. So we still have to be cautious. We still have to see what will happen, but certainly we're looking at what will unfold in the next couple of weeks.
And Dr. Fitzgerald, I'm wondering if you could talk about the sports guidance that came out this weekend. In there, it says, for example, competitions aren't allowed, which is very limiting for organizations. So can you give me an idea of, like, what, for example, does softball look like if you're not allowed to compete with another team? So,
you know, the sports guidance we're public health nerds. We're not all athletes by any stretch. So that sports guidance was developed in consultation with, you know, the Sport and Recreation Division of Children, Seniors and Social Development, and the sports federations themselves, which I assume would have consulted with the individual sports in their federations. So that guidance was developed with all of that input. So we defer to their expertise in that area. So I think a lot of sports are going to be thinking about skills and drills, especially with kids. You know, and people have to think about how they're going to be able to do that safely. But I would have to defer to the sports federation's expertise on that answer.
But what is the thinking around why competitions aren't allowed? If people can still do the physical distancing, something like softball where everyone's spread out in a large area, why not allow competitions?
So competitions for a lot of sports are not able to limit physical distancing, and so that's part of the issue. People are breathing heavier. We know that when you breathe with more force and faster, that you will release more virus if you are infected, and so there's that concern. And then of course you're coming into close contact, and then you have a lot of people coming into close contact. It could be in certain sports. So you know, that's the concern there, and that's the main reason that competitions are not going ahead at this level.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
I'm going to go back to a question that Tyler Dunn had asked in terms of the guidelines for businesses. So are these enforceable then?
So the orders, no, these guidelines are not orders. Orders are enforceable. However, there are, you know, certain things that are part of legislation that are not related to COVID-19. That have to do with occupational health and safety, and then safety of a facility outside of occupational health. So, you know, there are other pieces of legislation in place that are enforceable outside of these guidelines for COVID-19.
And Minister Haggie, I'm wondering if you can explain why we've left a lot of the health procedures to the Regional Health Authority when we have a Department for Health that could probably give as great of guidelines, if not more, in terms of knowing that a lot of areas of the province didn't have any cases of COVID-19 for quite some time now.
The issue around what procedures and what levels of activity go on in the regional health authorities was a discussion between the department and the RHA concerned and the public health experts, Dr. Fitzgerald's team. Effectively, we took a decision collectively that we would stick with a provincial approach based on the fact that we did not know at the outset whether a different approach will be better. The decision as to how to reverse that process now in terms of what procedures would be being done this week, for example, that weren't last, that has been left to clinicians in the regional health authorities. Clinicians always had the discretion to label a case as urgent or emergent at any stage during the pandemic, and that would have been managed immediately. And that never changed. So it was a dialogue. There was no playbook for this. Whether we would do that differently when phase 2 comes or wave 3 or whatever happens next, I think is one of the learnings that we will take away from when we get a chance to debrief when this one finishes.
And on May 22nd, you had said that approximately in a week we'd hear more about fertility clinics. It's been more than that, and we haven't heard from the RHAs in terms of what they're going to be doing to help with fertility clinics, knowing that places like Halifax and Calgary, their clinics have been open since the beginning of May.
Calgary is the only one that's been open since May, as I understand it. The fertility clinic is an arm of Eastern Health. Anything that was regarded as time-sensitive, such as preservation, these kind of things for cancer patients, those activities never stop. In line with the Eastern Health, my understanding is that in line with their other clinics, the fertility clinic will be starting up business for its usual range of services and routine appointments over the course of this week. Exactly what time of this week, I couldn't tell you. That would be a question better addressed to Eastern Health. It's done in the same way as a lot of specialty clinics would be done, and it was left up to the clinicians involved to determine whether or not someone's needs were so time-sensitive they had to be done during the pandemic. That was a clinical decision, and it was never an administrative one.
Thank you.
Our next questions are from Andrew Robinson of The Telegram. Please go ahead.
Premier Ball earlier brought up the announcement today from the federal government regarding the limited exemption for immediate family members of citizens and permanent residents being allowed back into Canada to reunite with families. He mentioned, too, that these people would still need an exemption from the province prior to coming here. I'm just wondering whether the province, will it be still exercising a right to deny entry to people in these situations if it felt that was warranted, or would it simply be a matter of kind of more or less rubber stamping their coming to the province?
Well, there's a process, Andrew, that you're referring to through the exemption orders or the. So what happens there? Those individuals that want to travel, in this case, to reconnect with family members. That could be spouses, or it could be in-laws, and so on, or children, as an example. So there's a number of people that actually fit the definition of those for family reunification that could come back into Canada, and therefore, in some cases, make their way back to Newfoundland and Labrador. So the process is the same for everyone. You apply for the exemption orders that we just outlined. If that's approved, most of them are. There's about an 8% denial rate on those that apply with, and make sure you put in the necessary information. So it's the officials are doing a good job with that. So once you get through that, then you come into our province and then isolate for 14 days. So it's the same process for everyone.
Minister Haggie, I wonder if you could offer a comment on, with paramedics, early on in the pandemic, was there any noticeable drop in the number of calls they were receiving? And has it been noticed whether that volume has returned to normal levels?
It's a good question. Certainly the biggest drop for ambulance operators in general has been routine interfacility transfers because of the nature of the way business was conducted through the RHAs. I couldn't tell you if there was any drop in emergency calls. I'd have to go and look at that data. But certainly from the point of view of overall workload, ambulance operators' workload did drop because there weren't the routine moves between one facility to another.
One last thing there for the Chief Medical Health Officer. There was mention of the possibility that, we could see another change in alert levels, earlier than 28 days. I'm just wondering, what sort of factors would have to line up in place for that to happen, and if there's a timeline for, when the province may start to consider looking at that as being feasible.
So, certainly we wouldn't be looking at changing or moving faster than 2 weeks. It would likely be closer to 3 if we were to go earlier. And that's simply just because of the incubation period. We need to give time to see what's going to happen with the changes that we've made. The things we will consider when we're looking at this would be if we start to see cases where we don't have an identifiable source for the infection, so it's not travel related or it's not related to somebody, it hasn't, like a close contact of a traveler who developed an infection, that sort of thing. That's a concern, because if we can't find a source, it means it could be in our more widespread in the community. Certainly if we started seeing hospitalizations as a result of infections, that would be concerning. So, the rate of hospitalizations, if we started to see an increase in positivity in our testing. So there's a lot of things that we would be considering, and no one thing in particular will necessarily make that decision for us, but the combination of all of those things together will give us, will be the information that we use to determine if we move to the next level more quickly.
Our next questions are from Elizabeth Whitten of all Newfoundland and Labrador. Please go ahead.
Thank you. This is a bit of a follow-up on inspections, but I'm wondering what could happen to a business if they found to have disregarded a public health guideline.
So at this point, if the disregarding the guideline was significant, and somebody, so an environmental health officer, for example, had to inspect and felt that that wasn't that something was happening that may not be safe, then the education would be provided, and the business would have time to respond to that, to be able to rectify the problem. We don't want to go out there closing down businesses. The whole point of this is to provide education, to allow people to be able to function safely within the pandemic. And so certainly first and foremost, the approach is to provide education, provide support so that people or businesses would be able to do what is safe and what will protect the public and the employees of that business.
Thank you. And on Friday, Minister, you mentioned the province's PPE situation had improved, and I was wondering if you could go into some more detail on how the situation had changed recently.
That's a good question. It's an ongoing concern is PPE. Certainly since we have our own supply of face shields, for example, now through Polyunity, we have no issue with face shields. They are no longer an issue. If you look at PPE in the other categories, there are 4 sizes of gowns, 4 sizes of gloves, 3 sizes of surgical masks, and 3 or 4 sizes of N95. So the global number within each category only tells part of the story. Overall, we burn through about 2,000 to 3,000 gowns per day across all sizes, across all RHAs. We are currently down to 1 size of gowns for a week's supply, but others we have 4+ weeks. So it's very difficult to give you a categorical answer as to how long the system can run. We get supplies in are late and light, but they are coming in at a rate that matches our burn rate. Even now, we've gone from, say, 59% bed occupancy overall to 69%, and we are able to supply some of our our workers in healthcare who we hadn't traditionally supplied masks to, for example, to the private personal care homes and to areas in home support. So we're matching supply with demand, but it's still, and it's no way to underestimate the huge amount of work that's gone in the background. To say that makes it sound as though it's easy. It has been a struggle every week.
Right, and you kind of touched on something I wanted to ask as my follow-up, the local production of certain aspects of PPE. So how much of our local consumption is coming from local producers now?
At the moment, we only have the polyunity shields that are certificated and produced and available. There are prototypes of gowns and gloves with Health Canada from local manufacturers, and they are at a validation certification phase. I haven't heard that they have yet completed those. My understanding is that evaluation is currently ongoing.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
So I'd like to come back to this new development regarding American travelers coming into the province, family members. Isn't it a little bit ridiculous that a family member from the United States could come to the province, but a seasonal resident that holds a property in Newfoundland and Labrador is not able to under the same rule?
Well, if you speak to people in the communities right now, there's still a number of concerns, as has been mentioned by Dr. Fitzgerald, and I think others, no matter what you would have seen in terms of positive cases coming into the provinces, regardless of not just here in Newfoundland and Labrador, but other jurisdictions as well, is it's usually travel related. So there are still concerns within our communities about people coming in from other provinces, and I don't need to name those provinces. I think we know them. We've done a good job in Newfoundland and Labrador. People have been very compliant, and so they are still concerned. But when it comes to family members that want to these are people that have not seen family members for months now. So the federal decision to open up the borders to allow families to be reunited was a federal decision. Then, they must comply then for the provincial restrictions and regulations that are put in place for them to move safely back to our province. So the comparison that you make, I understand where you're coming from, and we respect the fact that people have made investment in our province. All I can say is it's going to require some patience for their own safety, for the safety of Newfoundlanders and Labradorians. We want to make sure that we exercise and work with the plan that we've put in place. And until we get into a position that we're able to open up our borders for some people to come, extra people to come into our province, well then, we'll just stay patient, stay disciplined before we allow that to happen. This is really not who we are as a province. I think everyone is aware of that. We would like to be in a position to bring those people back in, but just not yet. And as I've said so many times, let's learn to get around our own province safely first. Let's learn to get our businesses back safely first. And when we get in that position, other options can be considered.
But it seems that the way that we're now approaching this is that you could have a family member from New York, one of the hardest hit places in the world, come to Newfoundland, but you couldn't have somebody in New Brunswick or somewhere in rural Ontario that could come to Newfoundland. So it doesn't make sense. So how do you explain that to people who are no doubt asking themselves the question, listening to you respond to the questions today?
Reuniting families is very different than someone wanting to come here and live in a seasonal home. It's very important to keep our family units together. In this particular case, that's what this decision was about. And, you make a good comment, and we're not arguing the fact. What we're saying is that we put in place a plan. The plan that we put in place for Newfoundlanders and Labradorians is to protect Newfoundlanders and Labradorians, and that is working. Now we're in a situation where we can actually bring and reconnect some of those families. That is what this decision is about. And until we get into a decision that we can move around our province safely, get our businesses opened up safely, get some people back to work, that's the priority. That's the next priority for the decisions that are being made by public health officials. So we'll continue to monitor this, We'll continue to watch this very closely. And at some point, if we're in a position, as I just said, to be able to open up our communities even more, then we'll do that. But we'll stick with the plan, stay disciplined, we'll protect Newfoundlanders and Labradorians, and hopefully we'll be in a position to open it up and allow others to come back in our province.
Premier, the Liberal leadership race has begun once again, and now candidates who are looking to replace you are now able to speak out. Certainly, people are going to be looking for their input into the government's pandemic response. So, how can you guarantee that this leadership race, which will replace you, and as well that the politics involved in that race are not going to influence the decisions that are going to be made over the next few weeks while you're still in power?
This party knows me very well. I think the people of this province would know me very well. We've taken a very disciplined approach, and quite frankly, I'm not at all concerned that any of those two leadership candidates are going to be lobbying, me or other members of our cabinet to make decisions that will leave this province in an unsafe position. We make decisions on science, we make decisions on evidence, and I can assure you, and I can send this message to those that are running, but I'll send even a stronger message to Newfoundlanders and Labradorians. The decisions that I make as Premier of this province will be in the best interest of Newfoundlanders and Labradorians and will not be connected to politics. And I can assure you Dr. Fitzgerald would share this view as well. Our concern is protecting Newfoundlanders and Labradorians, and I think I can speak for the minister. He's on the line to speak for himself, but his decisions are based on evidence and science and in the best interest of Newfoundlanders and Labradorians.
Our next questions are from Abigail Wellman of CFBS Radio, Blanc. Please go ahead.
Good afternoon. My first question is for Premier Ball. Can you explain what is Newfoundland Labrador's current position on the bordering communities of Quebec's lower North Shore being given access to neighboring communities of Labrador following the meeting that had taken place this past weekend, with noting that the neighboring lower North Shore has had 0 confirmed cases of COVID-19 since the beginning of the pandemic? Can you tell us a little bit about what was discussed at this meeting?
Yes, we had a great meeting on Friday of this week, or of last week. And so this is not unusual. We meet quite regularly, and the leaders of the opposition parties, they were participating on the call as well, as like they have on all the calls that have been passed. So it's been a great working relationship. The border and how people moving back and forth those borders was a large part of our discussion, as well as other things as well. So the Labrador South border that you're talking about, so this for our viewers and our listeners, this would be moving people back and forth from Blanc, which is actually where the airport is and where the ferry actually lands, which is in the Quebec side. So many of those, those people then travel into the south coast of Labrador. So there's been a relationship from services and sometimes health care, buying groceries, hardware, and so you name it. So the relationship there in that particular area has been one where it's been almost like a seamless borders for many, many years. Long before there was a road network, people moved back and forth this area and to do business. And matter of fact, families have been developed and along those same routes as well. So what it is there, what we've been asked to do is work with those neighboring communities, they are neighbors, and work with the leadership in those communities to put in place a mechanism so those people can return moving back and forth and receive those services, sometimes in Labrador, but in other cases it could be in the Quebec side as well. So that's what we're working towards, but also making sure that we have people there on those borders to make sure that this is what it is, that currently within Newfoundland and Labrador is important that we keep and monitor the movement of traffic amongst all our borders. And simply that's what it is. This is not so much of turning people back, but just making sure we know what's happening at those borders.
May I ask, Premier Ball, do you feel that this may actually take place before you move to level 2?
Well, right now we'll continue to work with the leaders, continue to work with public health officials. We have travel restrictions in place, as you know, and we do this to protect people that live in that area and protect Newfoundlanders and Labradorians in a general way. So, not going to predict. We'll just continue to work with those leaders. We'll work with public health officials. There's been a really, really good job Never take that for granted. There's been some excellent work and a lot of cooperation that's working with those communities, and I'll be there to support them as Premier of the province, but also as the Minister responsible for Labrador Affairs and Indigenous Affairs. So this is a great working group. We've come a long, long ways, and the cooperation has been remarkable, and they deserve a lot of credit for the safety net that they have around them as well. And we'll continue to do that. But to put a timeline on, when those checkpoints will come down, it's a little premature as I speak here today.
Well, thank you very much, Premier Ball. And my second question is for Dr. Fitzgerald. My question is regarding the border checkpoint located at Lanse-Claire-Blanceblanc. It's not currently being manned 24 hours a day. Can I ask why Public Health has not requested a 24-hour surveillance of the border for any traffic that may be non-essential?
So Public Health in and of itself is not responsible for the border. The checkpoints are manned by other departments, so I'd have to defer your question there. Abigail,
I might be able to help you with that a little bit. Thank you very much, Janice. It is a good question. So what happens there is that the checkpoints are put in place really to line up with, the business opening, the commercial activity that would be occurring in that particular area. Also with the arrival of flights and with the arrival of our ferry network that lands in Blanc-Sablon, as I just said. So it's really about, where we see the usage and the number of people that would enter, that area, and the entrance points and the exit points that are there. So it's really just to line up with the normal activity in terms of commercial, health appointments and so on. So that's the whole idea there. But there are workers there from the forestry and fisheries land resources. They're working in conjunction with the officials on that site. If you remember, I think it was the end of May, that the Quebec Police Force, they were also there adding some security to that site as well. They moved out on the end of May, but we've kept our provincial presence there.
Thank you for clarifying that.
Thank you very much. We'll now move on to a couple of single questions. So if you would press star one, the operator will identify you.
Thank you. First question is from Kellyanne Roberts from MTV News. Please go ahead.
Thank you. I'm wondering if we're on the belief that a vaccine will eradicate the virus, and if we don't believe so, would we be prepared to deal with the threat of importing this virus forever, meaning some of these restrictions for travel could be here for years to come?
I don't think that's anybody's hope or what anyone is looking forward to. I think, a vaccine, some vaccines have been very good at eradicating diseases, or at least eliminating them from countries, but not all vaccines are able to do that. So, for example, influenza we see every year. What we hope with this virus is that we will find a vaccine that will significantly reduce the spread, that will provide some long-term immunity so that people are able to move about and that we can get back to a semblance of normal. But in all likelihood, as with most respiratory viruses, we will find that there are circulating amounts of this virus. It will be part of our background of respiratory viruses that circulate every year. But with a vaccine, hopefully we'll be able to keep that circulation in check. But I think, the hope of eradication or elimination at this point, probably not quite there, but I don't think anyone is thinking that we're going to have to be living like this forever.
And our final question today is from
Peter Cohen from CBC.
A question about libraries. I've had a number of people who are book lovers wondering if stores can open. Why is it that libraries are still closed? We understand from the library board that they have a proposal in to government to reopen, and they're still waiting for that approval. So can you give us some insights as to why libraries are still closed?
So libraries are run generally by municipalities, is my understanding, and so certainly we would defer that decision there, but I haven't seen a proposal at this point, but certainly we'd be happy to discuss or to provide input on how to safely open libraries. Obviously, libraries are important parts of our communities. It's important for, not just for books and reading, but also technology access for people. So certainly we would want to see how we can make that happen safely.
Thank you, Dr. Fitzgerald. The time for questions has ended. Please join us again on Wednesday, June 10th at 2 p.m., 1:30 in most of Labrador. Have a great evening, everyone.